Hello, my name is Dr. Sourav Das. I am a consultant psychiatrist with Somnos Sleep Clinic. I am also attached as a visiting consultant with Medica Super Speciality Hospital Kolkata and Iris Multi Speciality Hospital Kolkata. I work as a consultant psychiatrist dealing with various kinds of patients, including those suffering from schizophrenia. And I do deal with general adult psychiatry, particularly those who have various kinds of psychotic disorders and addictive disorders in my routine clinical practice. To discuss about the treatment options for schizophrenia, we have to understand that schizophrenia can be like any treatment option in psychiatry involves two components. One is the pharmacotherapeutic component or through medications, the other is non-pharmacotherapeutic approach through various kind of therapies like psychotherapies including cognitive behavior therapy, interpersonal therapy and a lot of other different therapies. Now, for schizophrenia particularly, the role of non-pharmacotherapy is limited, particularly in the early part of the treatment process, and the most important part in the treatment of schizophrenia is medications. There are numerous medications which are used to treat schizophrenia, which commonly we call them as antipsychotics. They can be of the first generation like the older ones, they can be called second generation, the newer ones. Both have their different list of side effects, which I will be discussing a little while after. The treatment option means the person has to take medications. Initially they are given at the lowest possible dose and the least number of medications possible, and gradually looking after observing the patient and how the patient is reacting to it, whether there is an improvement, whether there are any side effects, the dose needs to be adjusted accordingly. Like it can be increased, it can be decreased, it can be changed to some other medication. Like that it happens, and this process usually takes a few weeks to months to get the symptoms resolved completely. And once the person is on the way to recovery from schizophrenia, then the role of non-pharmacotherapeutic approach like psychotherapy comes. The person can be put into psychotherapy to learn ways how to deal with his or her maladaptive thoughts. The person can be put into social therapy like for how to develop his skills of earning a livelihood, because in schizophrenia a lot of other times this happens is that the patients have lost their skill to develop. They have become restricted to their homes, they have lost their jobs and they have lost their productivity. So occupational therapy and other kind of therapies are very important in the later half of the treatment process. Sometimes we also put them for family therapy, because a person when a person is having schizophrenia, there is a lot of reaction from the family members. They tends to behave rudely with him or her. They do not understand the person is doing whatever is doing is not because of his own intention, but rather he is not able to, he is ill and he is not able to think properly about how to behave and all. So it creates a lot of family tension sometimes, that these things need to be resolved by therapy. Special therapy is called family therapy. So these things are important, but the most important things are the medications, at least in the initial phase of the treatment. Now coming to the side effects of the medications, the side effects are variable. It depends upon what kind of medication is used, at what dose it is being used, how fast it is raised to its the current dose, whatever the person is getting, how many medications are used together, and what are the person's predispositions. For example, a medication can work very well in Mr. A, does not work at all in Mr. B, and can work very well but increase the chance of having diabetes in Mr. C. So it is very difficult to determine what will how the medicine will react in a person before actually giving them. But though there are certain guidelines for which we psychiatrists all follow, and we try to minimize the risk of having any adverse side effects for any patient with any medication. Now the common side effects with the first generation antipsychotics are like tremor, like there is shaking of the hands and the body sometimes, and they sometimes can have something called as hyperprolactinemia, like in which there can be secretion of breast milk. There can be if the hyperprolactinemia persists for a long time, it can give rise to weakening of the bones. So these are about the first generation antipsychotics. In the second generation, the common risks are usually weight gain. It can cause weight gain for individuals because it increases their appetite, and the person eats more, the person gains weight more. Now the person, if instructed properly that he or she has to eat low calorie foods, then the risk of weight gain can be mitigated to a large extent. There are some other side effects like sedation, like the person may feel sleepy and a bit sleepy at work, but however these side effects are not very significant. Someone can have a little bit of constipation, a little bit of hesitancy while urinating, so these side effects can be there, but most of them can be managed properly if the person reports it to his or her treating psychiatrist. They can always adjust the dose, they can change the medication, and these things can be solved. And for most patients there are no side effects. This has to be understood properly, that if 100 patients are treated, maybe 5 or 10 may have some of the other kind of side effect, but 90 to 95% of them, they do not have any side effects, at least in the therapeutic dose that is given for treatment of schizophrenia. Now the question comes, how long it takes to for the medications to start their actions. Usually they are in weeks, but they can be in days. On the other hand, they can be in months. For example, in most patients, improvement starts showing within weeks of onset of treatment, but in some patients, they tends to feel better and get better even in days, like 2 days, 3 days, 5 days, they can get better. And in certain patients, or in those with very long history of this illness, they can take many months before showing signs of recovery. So this is very variable, but grossly for most patients it is usually in weeks. The most effective drug for schizophrenia undoubtedly is clozapine, which has been proven in research done across the globe through decades. Clozapine is a very, very powerful drug for treating schizophrenia, but at the same time, it has a few few serious side effect risks. For example, it can give rise to something called as agranulocytosis, that is the white blood cells which are present in our body, they stop being formed. So it can increase the chances of infection and the person can die if this thing actually happens. The risk is fortunately very low. It is like less than say, you can say 3 per thousand of like less than 3 per thousand people treated with clozapine. But still we have to in order to check for that and to prevent these kind of mishaps, we have to keep monitoring regularly the blood tests of the patient as to how the white blood cells are doing when we are giving a person clozapine. There are a lot of other side effects like weight gain, constipation, and sedation, like sleepiness, and all these things happen. So clozapine is a drug which is very powerful, but at the same time it has a few serious side effects for which its use is restricted. We do not give clozapine to any patient who comes to us for schizophrenia at the first instance, even in spite of knowing that this is the most effective drug for the condition, because of to avoid the side effect profile. They are kept or reserved only for patients who have a very difficult or resistant case, and for whom the treatment with other drugs have actually failed, or they cannot be tolerated. In those cases, we give clozapine. Now, what if a patient stops taking medication? The patient has got better, he stopped taking medication. So this is a very common finding which actually we get in our clinical practice. It is a very risky thing to do, because once the medications are stopped, gradually the person can have a relapse of his symptoms, and when the relapse happens, it can be even worse than it was initially. And most importantly, to manage the relapse, the medication needed are at a higher dose than the previous dosage, and often it needs more than one medications, because since it is a brain disease, we cannot change or replace or transplant the person's brain. We are keeping the brain, we are just trying to manipulate it by changing the chemicals and the neuropsychiatric functioning of those brains with medications. So if they are stopped, the things can of course come back. It's just like, you can say, a treatment of hypertension or diabetes. We can manage the condition, but we cannot change the underlying pathology. So what if no treatment is taken? If a person with schizophrenia is not treated, then the person, as we had discussed, already has a higher risk of various physical morbidities like diabetes, hypertension. It increases the risk of suicide. It increases the risk of harm to himself or to others. It can be seen as a harm not only to the person or his family, but also to the society at large. So schizophrenia definitely has to be treated once diagnosed. Now the question of whether schizophrenia can be cured, it is actually a very misplaced question, because only cured, the word means that a person is having an illness, treatment is done, and the illness completely goes away. This is applicable only for infective disorders, like a person is having malaria or dengue, and the disease is treated and the person gets rid of malaria, the person is cured. But no nobody is stopping another mosquito from biting the patient the next year, and the person can again develop malaria. So the word cure is often misinterpreted and misplaced. So in diseases like these, schizophrenia, in diseases which are not infective in nature, usually the word cure does not apply. Like you cannot cure diabetes, you cannot cure hypertension, because it is your own body. So schizophrenia is a similar kind of a brain illness which cannot be cured per se, but which can be managed very effectively and very well, and a person can live absolutely symptom free with the help of medications. In the initial part, in most of the patients, we can stop the medications after 2 or 3 years, and still the person shows no signs of symptoms of schizophrenia, and the person lives pretty well without medication for the rest of his life. That is the most common presentation. But however, there are some patients who do need to continue medication for a longer period of time, maybe their lifetime also, but it can be very well managed. But as of now, we do not have any cure to change all the malfunctioning circuitry from the person's brain. Thank you.